Absolutely. Is there a call for Deputy Jones?
It just might. Oh.
You realize, of course, that he sets things up so that he needs to be called, so you let us know.
May we dim the lights, Your Honor?
Please.
Dr. Schafer, as we go through this, there is no audio on the video, correct?
That's correct.
All right. So I'd like you to please describe for the jury what we're viewing, and at any time, if you want me to pause the video, please just indicate, and I'll pause the video.
Glad to. Okay, so this is an overview of the administration of sedation. And the first thing you do is you have to do the preparation of the room. So at this point, Professor Hung is reviewing the anesthesia machine, checking the equipment, and going through to make sure that everything is basically properly in place. There's emergency airway equipment that must be available. That's an oral airway to pick the tongue up from the back of the throat. This right here is called a nasal airway. That goes through the nostril to the back of the throat, again, so that air can go past the tongue into the trachea. This is called a laryngoscope. Can you pause for just one moment? Sure. And the laryngoscope is what you use in an emergency if you cannot move air into the patient. It's not surprising that we're starting our setup with airway equipment, because the single most important aspect of anesthesia ever is continued movement of air into the lungs. That's the most important thing we do, is we move air and oxygen into the lungs. So we're starting with simple things. An oral airway, which will just pick the tongue up in case the tongue falls to the back of the throat and blocks the movement of air. If that doesn't work, there's something that goes through the nose. Again, it's to go past the tongue so that air can get past the tongue into the windpipe. But if that should fail for some reason, then we may actually have to look inside the throat. And if you're going to look inside the throat, this is the instrument we use, the laryngoscope. And at this point, Professor Hung is evaluating that the laryngoscope, the blade and everything is working, but most importantly, that the light works. Thank you. Okay. So he verifies that the light works. Now the next step here is the endotracheal tube. Can you pause, please? The endotracheal tube is what you use if you need to get air directly into the windpipe. Rather than trying to go through the mouth, that tube is placed through the mouth right into the trachea, right into the windpipe. To do that, you need a laryngoscope, and you use the laryngoscope to look inside the mouth, and then you can see the vocal cords. And that tube is passed between the vocal cords. So that is something that an anesthesiologist always has ready as essentially your fail-safe. If all else fails, you can put that between the vocal cords and give air through it. Thank you. Okay, if you can, this is called a laryngeal mask airway. If you could pause this. This is an invention just within the last about 15 years. And what this does is it doesn't go into the trachea. Instead, if I may use my laser pointer here, this part that you see right here, this is a soft rubber portion. Let's see, this laser pointer, here we go. This right here is a soft rubber portion. To the left.
Correct. And that goes in the back of the throat.
And that goes in the back of the throat, but it wraps right around the larynx where the vocal cords are, so that everything is pushed out of the way. So you don't actually have to go into the windpipe itself. You just put this, it's a little, it's called a mask airway, but it's a little mask for the inside of your throat, sitting right on top, again, so there's an unimpeded flow of air and oxygen to the lungs. That is our most critical responsibility in anesthesia, is unimpeded flow of air and oxygen to the lungs. So we have multiple systems to see that that happens. You may continue, please. So this is placed, and he's just verifying that he has the unit here and that it appears ready to go. So I mentioned everything is organized. That may sound silly, but it's actually really important because when there are problems, you have to respond in anesthesia in a matter of seconds. You have to know where things are. It has to be set up. If you have to walk even a few feet and the patient's not getting oxygen, it's a few feet too far. So everything is placed where you know exactly where it is. And you can grab it literally in a heartbeat, your own, to have that instantly available for the patient. Continue.
The slide is verify primary oxygen delivery.
Yes, thank you. So oxygen delivery is key. And we have multiple sources in the operating room of oxygen. This right here is oxygen for a sedation case that will come through nasal prongs. And what you do is you have to see that, is it hooked up? Does the plumbing work? The anesthesiologist is responsible to be sure that this works. So if you continue, please. So Dr. Hung here now opens it up and verifies that, yes, here's the tubing. Is oxygen coming out of this? That goes in the nose. And what he will do then